CBC ordered? Yeah, all those blood cells. We want a baseline of how she's doing. LFT, who knows what LFT is? Liver function tests. Yeah, why do you want to check her liver? Because you might give her something that's hepatotoxic. And if she has decreased liver function, she can't have the PTU, right? And HCG, what's HCG? Pregnancy test. Yes. So we need to know all of those before she can be prescribed these medications, right? Okay. Oh, and also while the patients are getting these medications, they're going to keep getting labs every few months. So they'll keep being monitored. They're some pretty strong drugs. Usually providers don't want them to be on it for longer than 2 years because they're concerned about the long-term effects. So labs are back and they show that Jennifer's CBC and LFT are in the normal range and she's HCG positive. The nurse knows that the provider will likely prescribe PTU or methimazole. PTU, yeah, so she's going to go with the second line drug. Jennifer started on PTU. What adverse effects should the nurse monitor for? Good. So bone marrow toxicity. So tachycardia, heat intolerance, and weight loss, those are all symptoms of hyperthyroidism. So we know that her hyperthyroid drug is not strong enough if she still has those symptoms. That means we need to crank it up a little bit if she has those. Okay, so Jennifer stays on PTU for 2 years. At this time, her provider recommends that she undergo a surgical removal of thyroid tissue, a partial thyroidectomy. So she undergoes her partial thyroidectomy and recovers well. 6 months later, she comes to her provider's office for a follow-up visit. Her intake nurse finds that her vital signs are generally low. Why is this? Hypothyroidism. Yeah, she needs some replacement because she doesn't have enough thyroid cells anymore, right? And so if you see a patient who has a health history of hyperthyroidism and they're taking hypothyroid drugs, see if they had that surgical removal. It's very common. So what might her labs look like if now she's going into this hypothyroid state? I'm sorry? Everything's going to be lower. Her heart rate's going to be low. Her blood pressure is going to be low. Her T3, T4 are going to be low. And what about her TSH? It's going to be high because her brain's saying, come on, get going. Okay, so I like these slides that have all the symptoms. So the tricky one on this, the other one you mentioned, the clammy skin. The tricky one here is the anorexia. So this is not anorexia nervosa, the eating disorder. This means decreased appetite. Maybe the patient has decreased appetite because everything is slowed down. They're constipated. They burn calories really slowly, so they're not that hungry, right? So they're going to have the dry skin, whereas the other patient was sweaty. They're going to be tired, and whereas the other patient was like really jittery and anxious, this one's going to just have this flat affect. It's going to be hard for them to express emotions, and they're just going to have less emotional lability. They'll be less emotionally labile. So we're going to be looking at bradycardia, slower heart rate, lower blood pressure, like someone mentioned. Their temperature is going to be lower. So they're going to be intolerant to cold, and they're going to have that slow, foggy mental functioning. So this is a patient before their hypothyroidism was treated and after. So Jennifer's going to present like this. So what medication do you think she's going to be prescribed? Levothyroxine. So thyroxine is T4. Levo, if you think of elevator or levitate, it raises it up. So it's synthetic T4. So whenever you see it and you get mixed up, like, oh, is it hyper or hypo? It needs to raise that the T4. The nurse instructs Jennifer that levothyroxine should be taken